everyone. Oh my goodness, this is amazing. Thank you all for coming tonight. My name is Louise Bombecchio. I have to stand this close? Yes. So you did get my wow, right? Yes. Okay, thank you for coming tonight. My name is Louise Bombecchio. I'm chair of the Board of Trustees of North Country Hospital. I know I can speak on behalf of the full board when I say we are deeply grateful for you being here tonight and for your support of North Country Hospital. I can't see my paper because I'm so close. The Oliver Wyman report that came out 3 weeks ago sent a shockwave of emotions through our community. Shock, confusion, anger, frustration, and fear. The idea of our local hospital closing is frightening. We know it would be detrimental to our community's access to health care and would devastate our economy. We appreciate the many letters, public comments, social media posts, and calls in support of North Country Hospital, where many of you have shared your own experiences on how critical our hospital is to the health and well-being of our community. We feel your passion, especially tonight, especially now that I'm here. I wrote that before I even saw all of you here. The board and leadership of North Country disagree with much of the data presented in Dr. Hammery's report, not because we don't agree with or like the results, but because there are gross misrepresentations of the financial condition of North Country and what we actually do here at North Country, and because there was no attempt at an impact analysis of the draconian recommendations made by Dr. Hammery. Tonight we would like to set the record straight and provide you with the facts, where we stand, what we are doing to ensure that North Country Hospital is a viable going concern now and into the future. We do not disagree with the idea.
Room inside?
No.
There's a lot of people waiting out here. Yep.
Show up at 5:45.
Come around the deck.
You want to come out over here?
Come on the deck.
Go on the deck. You guys want to all pull forward here? Come on. We're just going to fill the room over capacity.
Like rolling the cattle trailer, you gotta push hard for the back.
Causing trouble over there? Mister.
I think I'll try to continue as we fill the room.
Don't want to bump the camera.
Over here. Oh, no, that's okay.
There's a gentleman offering a seat for anybody who maybe is having difficulty standing this long.
Did you need a seat?
He's right here.
He offered your seat.
Oh,
Thank you.
that's nice.
Thank you.
There's two over here.
Come on over. So we do not disagree in concept with the objectives of Act 167. They are to reduce inefficiencies, lower cost, improve population health outcomes, reduce health inequities, increase access to essential services, all while maintaining sufficient capacity for emergency management. These, by the way, were listed on page 5 of Dr. Hammery's report as they were perceived as the perceived outcomes that would result from his recommendations. We strongly disagree. Closing North Country Hospital would only absolutely work against most of these objectives. Long before Act 167 was passed, North Country was already working toward these goals, and we believe that we are making great strides toward these objectives, but we can't do it alone. There are many challenges to reaching these objectives. We can't solve the issue of lack of transportation in the Northeast Kingdom on our own. Access to mental health support and skilled nursing facilities puts a tremendous burden on the hospital. We can't solve the housing crisis on our own, or maybe at all. Attracting and retaining staff is truly difficult, and a report like this only makes it more difficult. Not only for North Country Hospital, but for every employer in the community. We do know that for transformation to happen in healthcare, we will need to make some tough decisions on how we deliver healthcare. Some of these decisions have already been made, especially at North Country Hospital, especially in the area of specialties. We can't be all things to all people as much as we would like to. Keeping North Country Hospital open will mean sacrifices, and we will need your support. Now I would like to turn it over to our CEO, Tom Frank, to share with you the status of North Country Hospital and some of the initiatives that are already underway to ensure that North Country Hospital is not going anywhere.
Good evening, everyone. Just to reiterate, I want to thank everyone for coming tonight. This is an amazing turnout, an amazing showing. It really shows how strong this community is when something like North Country Hospital, a true gem, a true, institution for this.
Maybe we can't hear you.
Hello, can you hear me now? Yes. Better? Maybe I'll just yell. Is this okay?
You can pull her another wireless.
Rob, can't you fix it?
Hold the microphone. Hold the microphone.
Can you hear me? Better? All right, sorry about that. So, as Louise said, I am Tom Frank, and I'm the CEO here at the hospital. This report, again, as Louise said, came as a bit of a shock to us, as in July we had a public forum here with Dr. Hamry came, and really didn't say that this is exactly what was going to come out. So we were all taken back, we were all shocked, and we were all very disappointed, as you can imagine. Although the report didn't specifically say close the hospital, but when you make the recommendation of no OB services, when you make the recommendation of no orthopedic services, when you make the recommendation of turning our ED into a 16-hour urgent care, and to turn our inpatient beds into mental health beds, that's basically saying close the hospital, correct? I think we all know how important the hospital is for this community. Not to get into Dr. Hammer's report, but as Louise mentioned, there were many discrepancies in that report that we attempted to address, and unfortunately they did not make it into the final version. One example is the report we received in July said 200 births per year, which is accurate. What the final report said was 200 births in 2 years. Taking the worst year we had financially and extrapolating out to make it look like we would require the state of Vermont to support us to the tune of $69 million is completely inaccurate. Speaking of finances, the last 2 years has been very difficult for our hospital. Several years ago, we needed to make a change in our electronic medical record. I think everyone knows what that is. But it's not just what the physicians use. It's how we bill and collect. It's how we book things in our general ledger, and it's been a disaster. We are currently suing Cerner because of how bad of a performance it has been for our organization. We are one of the most stable financial hospitals in the state of Vermont. We have 221 days of cash. That means if we didn't receive a penny starting today, for the next 221 days, we could still pay all our bills. That is the second most of any hospital in the state of Vermont. As an example, the University of Vermont Medical Center has 119 days. Yet, they want to close us. It makes no sense. The report made no sense to us whatsoever. As Louise mentioned, damage is already being done based on what the report stated. And let me tell you, I'll give you one example. We're trying to recruit for a very difficult position, a director of our pharmacy. We're using an outside agency because we have no choice. They contacted us and said, based on the report, I don't know if we're going to be able to find you a candidate. That's a fact. And there are other examples that I could use, but I'm not going to bore you with those other examples right now. But we're already feeling the effects of the way this report came out. Again, financially, we're very sound. We're not going anywhere. We've turned it around. We've made very tough decisions. We should be the poster child for hospitals in Vermont. We recognize that the cost of healthcare is excessive. We do not want to add to that problem. We are not the reason that the healthcare costs in the state of Vermont are high. Not us here in the Northeast Kingdom. We have the highest Medicaid population in the state. We serve the most economically challenged, the elderly, the oldest population, as well as folks who can't get transportation out of the community. We serve that population. From a healthcare equity perspective, and this is a big thing that Dr. Hamry talked about, healthcare equity. Healthcare equity is also about taking care of the disadvantaged. The Northeast Kingdom is made up of over 2,000 square miles. That's 21% of the total land mass in the state of Vermont. 21%. There are 2 hospitals in the Northeast Kingdom to serve a population of 50,000 people. It takes folks in the kingdom up to an hour to get to us. How are they going to get down to NVRH if they can't even get to us? Transportation is a humongous issue. Many of our patients don't have cars. They don't have vehicles. We have no public transportation. It makes no sense. None of that was included in the report. Not one bit of that was taken into consideration when the recommendations were made. None of it. So, I've been able to get out and talk to an awful lot of people in the state of Vermont. And that's what we got to keep doing. I even got 15 minutes with the governor, and the only way I could catch him was at Burger and Brew down in Martin. But our legislators have been supportive. We've met with every legislature. They've come to our board meeting. They've written letters. Everyone in the community is writing letters. I've had the opportunity last week to spend 2 hours with the chair of the Green Mountain Care Board, Owen Foster. He gets it, okay? He understands the situation. I was very impressed with our conversation. We met with media. We continue to meet with media. Anyone who'll talk to us, we're willing to talk to. We're getting the message out, and you folks are absolutely the reason of how we're getting that message out. You've got to keep doing what we're doing. People have to listen to us. Now, the report is just a recommendation. I don't know, I've been in the state long enough to know what can happen with just a recommendation. So I just really encourage us to continue to do what we're doing so that we can take care of the oldest, the sickest, and the most economically challenged population in the state of Vermont. Thank you very much.
What instigated the review?
So, the cost of healthcare in the state of Vermont, I think, was the driver. What opportunities exist to improve access, to streamline expenses, and to basically make the system function more as a system than it currently does. All of those are excellent ideas, and we support them. What we don't support is the recommendations that were made for North Country Hospital. It will not reduce the cost of healthcare in the state of Vermont. It will increase the cost of healthcare. It will put people's lives in jeopardy, and that's a fact. And we could tell you we could sit here all night and tell you stories of people who, if we weren't in existence, what would have happened to them, and that wouldn't have been a good outcome. It would not have been a positive outcome.
Absolutely.
You know, we're the only true, what they call, critical access hospital in the state of Vermont. To become a critical access hospital, one of the main factors is distance to nearest hospital and distance to nearest tertiary. We're 45 miles from the nearest hospital. 2 hours from UVM or Dartmouth. And you all know that because you have to travel there. No other hospital has those issues. None. The hospitals they mentioned down south that they want to close, it's not our job, not my job to defend them or what have you. But as a member of Bernie Sanders' team, who we spoke with last week, said, I live down there, and within 45 minutes, I can get to 4 hospitals. Can you guys get to 4 hospitals in 45 minutes? No. I don't think so. So that is why we're doing what we're doing here. We're doing this for the community. We're not doing it for personal gain. We're doing it for everyone here. Yes?
I think there's an argument to be had with regard to the fact that the kingdom serves the state by hosting a prison. Number one. Number two, we serve the state by holding the singular dump for the state of Vermont. New Hampshire has 6. I think there has to be a rescue consultant. There has to be.
Seriously, who hired
Let him finish.
The state of Vermont.
No,
Yeah.
no, that's too big.
Okay,
If
I
I
don't
could
know
just-
the
if I could just finish,
I don't.
if I could just finish, there should be, we need to think about this beyond just the hospital. We have to think about equity, justice, economic justice, health justice, and I think those arguments have to combine with the specific ones that you're making to say what is equitable for the citizens of the Northeast Kingdom. Thank you.
That's spot on. So from the economic impact, we contribute $61 million to the economy in the Northeast Kingdom. We employ over 600 people with good salaries and excellent benefits. Imagine what Newport or the Kingdom would look like if the hospital wasn't here. I can't even imagine. Yes?
To whom is the report submitted?
The report, from what I understand, was submitted directly to the Green Mountain Care Board and then made public through the Green Mountain Care Board's presentation Dr. Hamry made to the state on the Green Mountain Care Board website. Susan, correct me if I'm wrong.
That's correct.
Okay?
Does this have anything to do with the state legislature?
It certainly does. They are the state legislature, if I'm not, and again, Susan, help me out. They're the ones that created Act 167 so that this analysis could take place. So it starts with the legislature, then it goes to the Green Mountain Care Board for presentation, and then it's up to AHS through their healthcare transformation to potentially work with that document to make some changes in the state, but they do not have the power to close our hospital.
But the state legislature doesn't have to approve it, is that right?
That is correct. And all our
If we're gonna write to
legislators,
somebody,
are here, and I'm hoping you'll hear from some of them tonight. They've been very strong in the support for our hospital. And what's great, whether you're a Republican or a Democrat, everyone's come together in bipartisan support for our hospital. It's been excellent. Yes?
I'm one of the people that didn't know enough information when this started happening. So I did a little bit of research, and I can only imagine that there are other people like me in this room. And what I found out was that it was 2022 when Act 167 was put in place, and the purpose, and this is so super important, the purpose is to improve the quality, affordability, access, and sustainability of Vermont's healthcare system. We need that. We need a sustainable, quality healthcare system. There are also goals. The goals of Act 167 include the reduction of inefficiencies, sounds good, health inequities, to improve population health outcomes, and to increase access to essential services, something that we all want and need. So I'm looking at this and I'm saying, wow, Act 167 is great. I did find out that it included, Act 167 included funding for the Green Mountain Care Board. And So what I did was I looked at what is the mission of the Green Mountain Care Board, and the mission is to drive improvements in access, affordability, and quality health care, and to improve health outcomes for Vermonters. So what this is all about is supposed to be making our system efficient and giving us the services that we want, need, and deserve. We live in a rural community. It does not mean that we don't deserve health care. Well, then I looked at the recommendations. And I'm sure that you've all seen the recommendations, and they were stated just a bit earlier. And in my opinion, these recommendations just fly right in the face of the purpose that I just read you of Act 167, and they are completely antithetical to the mission of the Green Mountain Care Board. So, you know, I think that everybody here and everybody in our community needs to do some research and have some solid feet under them with what is actually happening. I was unfortunately ignorant about it, but I just think that if this hospital goes, it's going to start to decimate our community. It is going to just ruin us financially. It's going to dismantle the Northeast Kingdom. And if these recommendations are implemented, there's not going to be a lot of people that want to move here. There will be a lot of people that don't want to stay here. And who in the heck is going to be able to thrive here if these recommendations are put in place? It's beyond belief to me.
I heard someone behind me ask this question. I think everyone would probably like to know the answer. If the Green Mountain Care Board of the legislature, if the Green Mountain Care Board and the legislature can't close the hospital, who can? And how could that happen? And what do we need to do to prevent that?
So I guess we probably need someone smarter than me to answer that question specifically. But what has been told to me is that ultimately these are recommendations, it's our decision. What we need to do is exactly what we're doing. We have turned around our finances in 1 year by $6.5 million. Our expenses year over year are negative. We've had to make some very difficult decisions. As you all know, with respect to specialists, which are incredibly expensive.
Yeah.
We're doing the best we can with what we have, but we're doing it ourselves. We're not asking for help. We are not going to go anywhere, and we're not going to close.
I think there's general agreement in the room. My concern is, as you're finding with your pharmacist search, the word is out. What can we do to make them rescind the report or amend it soon? You said you had a good meeting, with the chairman. They've got to do something positive, or the effect, even if we don't go along with it, is going to be disastrous.
What I feel needs to happen is one of the state agencies need to come out publicly, as Mr. Foster has. He did it on, I believe it was Channel 5 or Channel 3. When he said these are just recommendations, that needs to be told loud and clear out to the state of Vermont that these are recommendations, and it's up to the local communities to make the decision on what they do with their health care. That's what needs to happen. It's a start. You can't take back what's already out of the barn, right? The horse is out.
They can repudiate the report.
We can certainly get into that type of a contest. And I won't say the word I wanted to say with respect to the contest. We know our data. We have the information. Dr. Hamry had the information. If anyone wants to listen on any of the groups, I'm happy to share. I shared quite a bit of information with Mr. Foster of the Green Mountain Care Board. He was very receptive to the information we shared. It's not a done deal.
Who are they answerable to? The Green Mountain Care Board. I hear you say that the legislature initiated the adoption of the Green Mountain Care Board, but who are they accountable to?
That's a really good question that I'm not 100% sure I can answer.
Tom,
Yeah, Russ.
so the Green Mountain Care Board is answerable only to you. That's what it is. It's a board that is, actually the Supreme Court did something to protect them from even being audited. But we just changed the law here a couple of years ago, allowing the state auditor to go in here and do an audit. The last time we looked at the Green Mountain Care Board, we found that they cost $2 million more than what they saved the state of Vermont. That's a true story. So they are responsible to you. That's the only way that it's going to be. I think that they did a real dumb thing here. I think that they really passed some things. I think they really showed how inept they are in managing healthcare in the state and trying to find ways to do exactly what Lisa had said that the intent of Act 167 was, which is to drive down healthcare. As far as closing this hospital, I can tell you that this hospital will not close. And why would Russ Ingles make such a statement of that? And it's already been proven. About 5 years ago, they came around and they said they were going to close all state colleges, but they just weren't doing it. And then it was determined that in all the areas that these state colleges were, they were such economic impact drivers to the area that they can't close those things. Well, North Country Hospital is far greater of an economic impact than it is to to any community. This hospital will not close, but it does do, as my friend and I were talking earlier, it does create problems in our community as far as to attract people to come here, with that hanging over them. So, yes, we are going to have to find a way to come and make them rescind a report or say, hey, I'm sorry, maybe the information we gave you just wasn't really that correct. We'll get there, but I would encourage all of you to keep doing what you're doing, support your community, come out here, let your voices be heard, let them show you where it's at, and we will get through this. It's unfortunate that it had to happen, because it didn't have to happen, but we will get there, and I can tell you, this hospital, nor NVRH, or anything like that, are going to close, but we'll all get there together. Thank you.
So if they're answerable to us, and they overspent by $2 million what they saved us, why isn't the legislature cutting their funding?
It's not that easy.
Can we vote to disband them?
It takes numbers in the State House. So yes, we can. Remember all these decisions that are being made and how it's being made when you go to the ballot and all of that. So as of right now, we have a majority down there that is they'd only do with what they want to do. And we need to bring some balance back to Montpelier. But yes, it can be. We just have to, there's things called elections, and they have consequences. And as we can bring some balance back to Montpelier, we can get to the goals that you've just stated.
Well, it's easy on the balance because the Care Board came in on Republicans, so. But let's not get into that.
So Tom, I've got a question for you, and maybe also for us. Of all these different groups that we could write to, what would be the most effective group or individuals that we could write to?
I'd start with the guy who's in charge, and that's the governor. Okay, because ultimately, it's on him. I would start with our legislators, the Agency of Human Services, the Green Mountain Care Board. They have a website. I would get it out there. I would call your federal representatives. I would call Bernie and Congresswoman Ballin and Senator Welch's office, and I would express your concern. I think those are all excellent places for us to start, and I think everyone's hearing it. It's everywhere. Brian.
Thank you. I'd like to respond to that. I've been listening to this great turnout, by the way. Anyway, I have sent letters. I spoke at Farm Bureau meeting last night about it. I sent a letter from the Derby Select Board and myself as a legislator to every town in Orleans County. And I've asked their select boards to send a letter of support to our Derby town clerk that I plan on putting on paper and delivering to the governor's office as soon as I've got all of them. I believe there's 18 towns in the county, I think. And the Farm Bureau wants to be included in it. I spoke with Scott Birch today, and he's going to try to put a letter together in support of the hospital. And I also included Brighton because they're a good-sized, large community. But I expect to have those letters within probably a couple of weeks, because some boards don't meet but once a month or every couple of weeks. And when I do, I'm going to go down to Montpelier and deliver copies to all the agencies that it's important that they see these letters. And I've got to say one very good thing about the North Country Hospital. I was there 9 years ago and I had a knee replaced. They're not, right now, they're not going to be allowed to do this if this happens. And I'd like to be able to think my right knee could be done right here. But I stayed an extra day at the hospital. They could have let me go one morning, but they had lasagna for lunch that day. They make the best lasagna. So anyway, but that's my plan, and I'm going to deliver those letters to Governor Scott and everybody else in Montpelier. Thank you.
1 year ago on purpose. Since I moved here, my oncologist is gone, my heart doctor's gone. Folks, it's up to all of you to write letters to the powers that be. Don't sit here and piss and moan and complain about what you don't have, about what's going to go away. You have to take action and get to the powers that be, from the care board on down to everybody you know that's got influence over somebody. And don't just send them an email, send them a personal letter written in your handwriting so they know you're a real person.
So we asked in the beginning of the night for people to sign up to speak. And I'd certainly like to start that list if people are okay with that, unless they have a specific question.
Tom, can I?
Yes.
So, hey, I'm Dave Berman. I'm a board member on the Green Mountain Care Board. I showed up late, so I assume all the praise was at the beginning. And this is Susan Barrett. She's the executive director of the board. I work as a clinical emergency doc. I came here after the end of my shift. I spent more time. I heard a joke when I walked in, so I felt like I could say a joke. I spent more time trying to park in Newport than I did last weekend. I went into Burlington with the kids to watch a performance. I found parking faster in Burlington. Sorry, it took me 20 minutes.
Because no one's left in Burlington.
It's safer to park in Newport.
It's because the medical center built the new parking garage.
Yeah, that's a good story. So, amazing turnout and engagement, community engagement. And while maybe the occasion seems to be upset with the Green Mountain Care Board and the report, I actually am really excited that there's so many people here dedicated to your hospital, to healthcare delivery in your area. I was thinking driving up here, we've gotten a lot of public comment about the report and about views from people in this area. And I was thinking about, my view of the report and my view of healthcare in Vermont and what I think about, and I do think a lot about what I do for work. Central Vermont has rural areas, but has a lot more dense population than here. And the number of patients that I come across on every shift that are no way in hell are they going to go to Burlington or Dartmouth for their health care. They're not going to get it. They can't, either they won't get there, they can't get there, they share a car between an extended family that may not even be registered, they can't bring it on the highway. There's so many, they don't want to go to the city. There's endless stories, right? Of why we need local care, local. And I'm very passionate about it. I think most of the board members are very passionate about it. And so I just want to sort of set the context and the conversation. Your comments about Act 167, the Green Mountain Care Board's mission, Those are all right, and actually, when I take away from the report, and being at Hamry's presentations and a lot of presentations from Hamry and some conversations, is that the report is really focused on a few things. The main findings are housing, right, and which we can't do with the Green Mountain Care Board, and we're not going to solve Vermont's housing crisis today, but that was really housing is the driving force. Commercial prices, he recommends reference-based pricing. Commercial prices are super high in Vermont, in certain areas of Vermont, and it's really starting to have a pretty big effect on our economy, on our taxes, on affordability in the state. And then trying to get as much healthcare that can be done outside the hospital. Those are 1, 2, and 3. The other things that I take away from the report are, wow, we have a rural state with with a lot of dedicated EMS providers that need more support and a professional system and benefits and a salary and an ability to coordinate that care so that we can get people from rural parts of Vermont, because I'm sure you can drive an hour east of here, probably through dirt roads. You're still in Vermont. It must take an hour to get to this hospital from some of your patients. 45 minutes, I'm sure, is standard, right? So you call an ambulance, or you need to get to a hospital for an appointment and back for, just for an appointment, transportation. I mean, I have a patient on my shift today. There's no way she can get to her appointment. We're trying to figure out, she's in the ER because she can't get to an appointment, okay? I mean, that's just the bottom line. That's a huge part of the report, is talking about transportation, talking about internet access in rural areas for home care, and increasing that, and internet access on ambulances so you can do clinical care during the portion of transports. That was a big part of this report. When it comes to the part that I think we're talking about today, I took a very different message away than I think you all have today here, or maybe some of you have today, which is that most hospitals in Vermont, with current expense growth, now granted current expense growth is looking at 22-23 timeframe, which has been historically high, and inflation, if you plot those out over time, all but one hospital in Vermont goes negative margins in the next 5 years. So it's not just North Country Hospital that we're worried about the financial stability of, it's the entire system. And 4 hospitals, Dr. Hamry called out, there's things in the report that I totally agree with, and there's things that I have a lot of questions I want to learn more about, and I think are really areas of more discussion, which I must admit a big part of his summary was we really want communities to be engaged in the future of their healthcare, which is what's so amazing about today. But with regards to North Country, given the financial picture that was seen from the data that was there, which I think we can have rational, reasonable discussions about, that it was one of the hospitals that had kind of one of the most concerning trajectories. And so the recommendations were, if you don't do something to get it going again, here's your other recommendations that you could do to preserve healthcare in the region. Again, some of that, as a clinical provider, I agree with. Some of those recommendations I would have a really hard time with.
But Dave, your board accepted that report. You read it. You have problems with it. And it's out there now, and we're having trouble hiring people. So thanks.
I think a lot of the attention that's been brought to this was not in the report. And so, I don't know if the hiring problems are worse now than they were before, and if they are, they're all over the state probably, because we're kind of called out just about every part of the state as having financial challenges. What it is a call to action to do something about it.
One step further, you guys paid this guy for this report.
Yeah.
So, I'm sorry. I've dealt with consultants, I've dealt with reports.
Yeah.
I'm having a real hard time with how this was managed, but that's up to you guys.
What about the pediatrics? There was no mention in this report of the pediatrics. Dr. Mosley, you want to chime in?
Sure. I must say you're a brave man to come and...
I'm here too.
In preparation for this meeting, I went and watched the video of your 2-hour spellbinding meeting that you had to receive this report. I heard almost no questions, and certainly no critical questions about the scope of the report, and especially the cost, the downstream effects of the report, how these various alternative systems will be put in place. Not really a peep. And so my question is, do you still feel the same way about that report? And as
Dr. Walker said, the fact that you didn't even mention children in it. I went and did a word search and then read the whole damn thing 3 times. I could not find the word pediatric, child, newborn, neonate, none of those things. There were a couple of psychiatric references to adolescents who were obviously the only kids in the report. But what do you say? I mean, you're going to go forth with this report, but you've accepted it, you paid the guy. Are you satisfied?
So I think it's a pretty extensive report, and I actually think he did a pretty impressive job of traveling around the state and getting a lot of community input. I really felt like I got a lot out of that.
There's a lot there.
There's a lot there.
There's a lot that isn't there.
And they're totally true. And this report was a basis for then the Agency of Human Services to take this information and work through all the transformation and implementation and honestly the feasibility and further analysis. This is a massive project just to get it here, but to refine these components of it is pretty extensive.
So I actually, I'm sorry, sir. The report contains recommendations. But I went to the garage today and the mechanic said, you need new brakes. That's what was in his report. I looked at my car and I decided I don't need new brakes. The point is, there are inaccuracies in that report that have to do with Newport, and Newport specifically.
And I also...
And so the report may be wonderful and thrilling and make you very happy and be very comprehensive, but Newport is getting screwed.
The other point here is to say that he actually did a lot of work. To say that he did a lot of work in this report is inaccurate. In regards to, and I'm an obstetrician, so in regards to his recommendations about closing the OB unit here, he used a report that was written by a woman who's a professor at the University of Minnesota. If he had actually spent even 5 minutes to email this person, which I did, by the way, if he had spent 5 minutes to email this person, he would have gotten the same response that I got. To use her report and use her data as a reason to close OB units in rural communities is incorrect and incomplete. Those are her words. All that does, if you close those units, is you push the risk of childbirth onto the other people in this community. And all it took, so if he was so complete, all it took was an email. She responded like that to me. So I think that to say that Dr. Hamry and Oliver Wyman and all of his New York City associates did their job well, I think is inaccurate. And I think you guys should look at that a little bit more closely.
To recommend low-volume procedures that hospitals should stop doing. The studies that he used were based in the 1990s and did not include the surgeries that he said we should stop doing because they were low volume. He used bad data, he cherry-picked studies, basically taking the title of the study and not actually reading it. That is our problem with this report, is he used bad data, bad, false, inaccurate data to come up with his recommendations. Folks, why are we paying for a study that is inaccurate and false? And he puts out these recommendations. This should be a simple thing. It should be tossed.
And why couldn't we find a Vermonter to do it? Why do we have to hire somebody from New York, like they know so much about the Northeast Kingdom?
Dr. Walker, if you get any more excited, we're going to have this conversation at the barn, because I see...
I mean, another thing is, if you're going to make a recommendation, you ought to put a simple litmus test out if you're going to talk about health care. You should ask yourself, is this recommendation going to kill people?
Yes.
And if it is, well, you know what? That's a bad recommendation, and it should go away.
Gentlemen in the back, please.
My name is Keith G. I have worked in healthcare for about 30 years, starting at the Medical Center Hospital, Vermont, going to a hospital in Pennsylvania. Dr. Hammery was our next door neighbor in terms of health systems. I know him well, know the way he works, and I have copies of some of his papers in the past talking about how he designs a system. And I was surprised because that's the way I designed our system, and it looks surprisingly like what appears to me in some spots. I would encourage you. I agree that the recommendations are horrible. As a healthcare administrator and a consultant, I can't buy into that. Their depiction of the future of healthcare in Vermont, though, is on target. It is going to get much, much worse, and every healthcare system in this state is going to be challenged to survive. The second thing, his description of forming a statewide system with clinical, unified clinical departments that cut across everyone in the state, and I designed that many years ago. I've spoken across the country on it. It works. We built a health system with 9 hospitals, same geographic area as the Northeast Kingdom. We were all floundering hospitals when we started. We are now one of the strongest in Pennsylvania. It has $5 billion in the bank. And we recruited 400 doctors in 1 year. And there's good stuff in there. And I'd be glad to help anybody dig into it and explain some of his thoughts. But don't throw it out.
Transportation system to support that.
What?
We don't have it.
You don't have what?
There's also a larger population down there.
Yeah,
I
and a
appreciate
transportation system to support that kind of diversified healthcare system. It's not available up here.
Part of our area also was small rural hospitals. We lived in the rural part of the state, in between Philly and Pittsburgh.
So thank you, sir. And one of the things I'd like to comment on real quick, is healthcare in general in this country is under attack, period. Dr. Hamry continued to mention Massachusetts as like the glowing child of healthcare. My daughter is a nurse at Beth Israel Deaconess Hospital in Boston, one of the largest systems in Massachusetts. They're $200 million in the hole and are laying people off.
Yeah.
Okay? That's happening in New Hampshire, that's happening in Massachusetts, and it's happening in Vermont. You're right, sir. If we were a system, I don't disagree with you. This would be a much simpler process. But we are not. And by having a recommendation by Dr. Hamry to close 4 hospitals, it's not going to make us a system.
I agree.
Who puts these people on the board, on this care board? Is it the governor? Is it somebody else? And how did they come
Well,
up
there's a
with
committee. Okay? People can apply to be on the Green Mountain Care Board when there's an opening. And there's a committee that makes a recommendation. And I do believe it is the governor who has the final say of who they put on hand.
Because there's no way these people are going to rescind that report. You're going to have to get rid of people and bring new people in. It's just not going to happen.
Nope. So Tom, I've got
The report doesn't say to close hospitals. So it just doesn't say to close hospitals.
Tom, I've got just a quick question from the board. You've heard from Dr. Mosley, you've heard from Dr. Walker, that your report that you're looking at is flawed and inadequate, it's incomplete. Do you have the courage to amend that report and make it right?
So it's not my report to amend. What I would like to do is have more discussion about it because I actually have many of the similar concerns.
So what are you going to do about that?
Well, there's a process of public meetings and discussions, and we have meetings internally and externally, and we're going to work on that. But we didn't. The report doesn't recommend to close North Country Hospital. Incredibly supportive of North Country Hospital through the years, and I think the care board members are very supportive of North Country Hospital. Now,
I think that's it.
Mr. Franks had a conversation with Owen yesterday. I heard him say, I think Chair Foster is incredibly supportive of North Country
So
Hospital.
listen, I'm going to agree with that statement. I do believe that 100%, that the Green Mountain Care Board is not going to do harm to us financially. They're not going to do it. I do believe this report is completely flawed. Dave, I'm happy to sit down with you anytime and go through this with you one-on-one, as I did with Owen. But we need to be heard, and I don't want to make it a pissing contest. I just want to be able to get accurate data that we asked Dr. Hammerly to put in that he promised he wouldn't. He didn't do it.
Garbage in, garbage out.
Yep.
We
Can
can
we
take
do
the
that?
data and we'll
corrected
share
public
it
statement.
with OW, with Oliver Wyman, and we'll take that back
And you're
and
right.
see if we can
It
have
doesn't say
him
close
amend
hospitals.
anything. Yeah.
It really doesn't. And I've said that. I said it here earlier. But when you close OB, okay, that's a recommendation. When you stop doing joint surgery, that's a recommendation.
I think there are recommendations if you're going down.
We'll
But they're out there in the.
Yeah, but the,
Sounds like
the
you're
data
not
being the data being used to decide whether or not we're going down is garbage in, and you end up with garbage decisions out.
So the recommendations are for the hospitals to consider and the community to consider and to have a conversation and discussion.
Yeah.
And for any
The board
pharmacist
does not
who
have
wants to
any
get hired at the
control of
hospital.
what service a hospital has.
Right.
We have no control of what care you provide. And I think, and I have a lot of similar thoughts about rural surgeries, rural OB care as these gentlemen here. And I think many of the board members do.
Yep.
But unfortunately, it's OW's report to us.
I get it, but if I had commissioned a report that had that cost me that many zeros,
Yeah.
I would be damn sure that the information being put into it to drive decisions was good data.
Absolutely.
Laurie Burger. So I'm just going to make a recommendation. You're going to need to get out in front of this like today and let the community know, because on Facebook, which I realize is of social media, there are people who are scared and they are commenting that they are scared and they think this is something that's going to happen right now. And I tried to waylay the woman's comments, but people think it's closing soon.
I think Franks has been pretty clear here tonight that the hospital is not closing. The decision to close the hospital lays within the hospital and the hospital board, not with any other organization. So I think that's where the message comes from strongest, is they are here. Sounds like they're here. They're very stable, sounds like, from the recent years after a few very rocky years, which I think you may have discussed. And so, you know, I would assure you that the board is very supportive of North Country and its mission.
At the end of the day, it really boils down to what is public policy. You know, what is the governor leading with? What is the legislature leading with? And the question is, should 20% of Vermont geographically in an economically disadvantaged region, what basic level of medical services infrastructure should be there? And that goes beyond the board, and it really does fall into the lap of the governor and especially the legislature to say 20% of the state should have an adequate level of medical infrastructure to service that geographic area, because geography and economics matter immensely.
Hi, I want to give you a little bias here. My wife is on the board. I'm from Morgan, Vermont, and I've been in financial services for 50 years.
What board?
The North Country Board. So I have a little axe here, but I want to tell you that the primary thing to me is health care, and the best and easily accessible health care is a right for all citizens in Vermont. Not only those that live in Burlington, Rutland, Brattleboro, or Stowe. We need to have the best. I can remember I did a lot of work down in Haiti, and there was a rural health model down there, and there was a guy that ran Partners in Health. Very, very famous guy. And he said Haitians in the most rural areas should have the best health care. It shouldn't be only those people in the biggest cities. And that's what I think the primary driver in this study should be. How do we deliver better, cheaply, more effective health care in Vermont? But my second point is that Oliver Wyman's study is extremely flawed. I worked as a consultant for over 10 years in New York. I know Oliver Wyman. I know the guy that founded the firm, Chuck Browther, and I think we got the lowest cost solution for this problem. Why wasn't McKinsey hired? Why wasn't Booz Allen hired? Why wasn't Bain or BCG or something? So from a medical perspective, we need a second opinion on this study. We need to have somebody come in and check their work. It's flawed. All of the data that was used, as you heard before, is inconsistent, it's not effective, and as Steve Wright said, garbage in, garbage out. You know why you hire a consultant, don't you? He tells you what time your watch says. And that's what we got here. So my next party that I think we should really hold the task on this is the Green Mountain Care Board. When you start a study, and I was a consultant, you go in and you interview the provider, the vendor, the manager of the study, and you get their acts, you get their view, you get their opinion, and that drives where you're going to go in that study. And that's what I think we had that went wrong here. That it started out with a point of view, and it was driven home over a year of all the canvassing. And I'm really sad. This is a wonderful, vibrant community, and North Country is such a major employer here. Do you realize, as you heard some of the data, if we took North Country out, what would happen? So I'm telling you one last thing that I think is a recommendation. Besides hiring a name consultant, somebody with reputation, that's marquee, that's the top, a McKinsey, a Bain, a Boston Consulting Group, not the second tier, not the JV committee, which is really which is Oliver Wyman. I do know them from financial services. I competed against them all the time. And when Marsh bought them, I thought, oh, we're going to flesh this out. I don't think this consultant did us right. He did not really come, and he would not, a good consultant would have stopped the train and gone and revised the conclusion. Would have said, I'm being paid $2 million, and I'm over budget possibly, but I have to go back and I've got to change what has been set in stone because it's going to influence the community. It's going to influence the thinking. And we need to make sure we get that second opinion. The last thing that I think we should do here, all the legislators should be held to task to review what is the Green Mountain Care Board doing.
Yes.
Are they empowered to really help us? Or are they sitting somewhere in an ivory tower, 4 or 5 people that really don't have our interests at heart? So I would ask you, and there's some questions that I would propose to the legislature. This group is extremely powerful, the Green Mountain Care Board. In fact, I've been told they're more powerful than any of our neighbors in overseeing health care in the state. It's just one more bureaucracy, the state of Vermont. Are they really doing the work and protecting us as citizens? Who is Green Mountain accountable to? I did some research as well. You can go and see the YouTube report that was done there. I was really halfway through it and I couldn't stand listening to the rest of the pontificating that was done. Are there term limits on its members? None, I'm told. Or who are they accountable to? It's to the governor. Any of the members chosen by the people? Do we have any say in that? It's all down to this nominating committee, and there's 2 or 3 seats that are from the people that are part of that nominating committee. But I don't think we really expected anything like this. So I'm recommending the third thing that I think we should do is let's have an independent study and a review of the Green Mountain Care Board and what they're about and whether they're really effectively helping us here in Vermont. Thank you.
Sir, you want to speak up?
Sure. My name is Andrew Sebastian. I've been a family doctor for 37 years in 2 countries, 4 states, and I've seen politics and politicians do this to hospitals and healthcare workers everywhere that I've been. You hire a consultant, they're disconnected from the whole thing. They're supposed to be engaging the public and the people. They come and they meet the people, they say one thing to the people, they report something different to the board. All they're in it for, personally, is money. I think if the Green Mountain Care Board really cared and wanted to streamline the process and help our patients, I mean, I just moved from a big city to here to help patients out, then you have to be engaged with us and the people. You cannot lie to us. You can't fool us. We're not stupid. I mean, these are intelligent people here, and we care about the community and the people. Stop hiring consultants. They just, as this board member said, they just give you back what they think you want to hear. Closing hospitals, I mean, you know, Massachusetts is supposed to be so good at healthcare. You know, you got the Stewart healthcare system there that, you know, I don't know, 5 hospitals closed. Do they recognize what effect that has on the hospitals that already exist, the emergency rooms, the EMS groups, the ambulance attendants, and how many people die because they cannot get the health care they need when they need it? We need to feel trust, honesty, we're intelligent, talk to us. And the other thing that I haven't seen the Green Mountain Care Board do is come up with ideas as to how to accomplish some of those items that are mentioned in the Act. I mean, we're talking about money all the time because that's what all politicians seem to be worried about, is just money all the time. It never seems to affect their check. But it affects ours, it affects our patients, it affects the care that we give, that we want to keep on giving. Let's not lose track that we're taking care of people. We want to keep doing it. We need honesty, transparency. If you're going to talk to us, don't lie to us.
I'm Richard Nelson, and I'm running for House in the town of Derby. And I'm unopposed, so I'm there. And I stopped farming to be here tonight. Okay, that's how important it is to me. And all the doctors standing over there, Dr. Peck delivered my daughter December 22nd, 1998. And if that hospital hadn't been there, my wife wasn't in there 30 minutes and she was born. Now, I'm a farmer. I've delivered a lot of calves. She's a veterinarian. We could have figured it out on top of Sheffield Heights. But it was a lot better when Dr. Peck flipped the hemostats over and had me cut the umbilical cord. And I thank you for that. Dr. Walker has passed gas on me too many times. And my father has been in twice this month with tachycardia and turned around and right back out, and the next morning the first truck in the field. And if you don't think that doesn't mean a lot to a bunch of boys out there farming, it means everything. There's 3 pillars of this society that are great. Our schools, our jobs and recreational abilities, you know, even up to JP. The hunting, the fishing, the water sports, biking, jogging, running, everything, the bike path, and our health care. And if you break off one of those legs of that stool, it's going to fall over. So, the legislators, we've heard you. And I was here when Dr. What's his name was here?
Give me a little more information.
Who was the doctor here?
Hammery.
Dr. Hammer?
Yes. I was here when he spoke. And he spoke about our demographics. And he's spot on. And legislators have got to change Act 250 and take the damn noose off our neck. I've got a 20-acre field that is serving our farm no purpose. That's right off the edge of Derby line. That ought to be 20 to 30 affordable, suitable houses for young doctors, nurses, Department of Correction employees, farm work, everybody. And I asked the developer, how do we go about starting the ball on that to make affordable, suitable housing? He said, not happening. Not in this state, not now. And that's where we need to start. He was right about the demographics, and we can fix that. And if we fix that, it fixes the school, it fixes the hospital, and enables the rest of the community to thrive. We can't thrive without young people here. So, that's my rant.
Catherine, just want to reiterate that your legislators are united in the support of the hospital. You all may have seen there is a letter in the Chronicle this week. We've been engaging, so the legislators have been meeting with the CEO, the hospital board, and advocating with the governor's office, with the speaker, the chairs of the healthcare committee. As Richard said, North Country Hospital is vital to this region. We absolutely support increasing access to quality health care at an affordable cost. And in no way does turning North Country into a 16-hour urgent care facility increase access to care or save any money. We all know and have stories, I'm sure from our own community, about how lives will be lost if we only have access to 16-hour-a-day care. So your legislators are hearing of these messages. We are engaged with the hospital, and we are advocating for the future of our critical healthcare facility.
That's all good, Catherine, but what is the legislature doing about this report that's out there and is obviously affecting employment capabilities at the hospital? It's obviously affecting the community. I mean, people are afraid. So I hear you, but is anybody sitting there saying we're going to claw money back from these guys?
Yeah, so I appreciate that question. I'll say one thing. In anticipation of the study, we worked with the hospital to set up a tour for the chair of the healthcare committee so that before she got the report, she had seen North Country Hospital. We did an extensive tour, and we not only saw North Country Hospital, we visited the new Front Porch mental health care facility, urgent care facility. We visited Journey to Recovery to hear about the work of the substance use disorder community. We went to urgent care. So we've helped bring folks who will be making decisions about whether we do or don't act on the recommendations of the report to really familiarize themselves with and see the value of healthcare delivery and the collaboration and cooperation that's happening across all of our partners. I asked that question to the Secretary of the Agency of Human Services when they were up here for Capitol for a day. I said, we paid a lot of money for this report, hearing that it's based on inaccurate data, that the consultants were informed was inaccurate before it was written. I don't think we're getting our money worth. And what can we do to ask them to revise it, to retract it, or can at least the Green Mountain Care Board or Agency of Human Services publish an addendum with the actual accurate information and call into question those recommendations? They said they would do their due diligence, as we heard already. There hopefully will be lots of questions asked of the consultant. I know that the hospital is working hard to provide that accurate data to AHS and the Green Mountain Care Board so that the notes can be compared, and I hope that we can move forward with some sort of addendum or maybe updated version of the report, because you're right, we paid a lot of money and it should be a good report.
Yeah. We asked. I don't tell you that right
No,
now.
I mean, not you, us.
We were all walking away from this experience, which I wish didn't have to happen in the first place, but better appreciating the value of delivery of healthcare here and the role North Country Hospital plays, and that we can all be ambassadors and help be more engaged in the conversation around healthcare transformation in a way that works for every corner of Vermont, including up here in the Kingston.
So your voices are being heard. Okay? Your voices are being heard. Perfect example. You know, the Green Mountain Care Board folks are here, and they knew they were going to get slammed, but they're here. You know, I am meeting again with Lori Houghton, who is the head of the House Healthcare Committee. Okay, so these people are listening to us, and we're getting it out there, and it is up to the voices in the community to be honest and accurate and tell our story. And that's all we're asking to do. Listen to us here in the Northeast Kingdom. Dr. Mosley, you got it.
Dr. Merman, I have a question for you. Having heard this pretty unanimous sense of objection to the quality of the report, is there any possibility that the Care Board would take up formally a revision and ask for reanalysis, or at least give, other than a completely unquestioned assent to the conclusions, which is what I saw in that meeting I referred to?
Yeah, I mean, I am totally supportive of, to me, getting the best data we can is the most important thing in a report like this. And I've been under the impression that the data was brought to hospital boards over the summer regarding specific surgeries and what were done, regarding volumes. I think Voz provided a lot of the data that we had. I was not aware of your objections to the specific data until the
There's one example. One example. I'll just give you one.
Yeah.
Dr. Henry quoted 10,700 ED
Yep.
visits. We do 16,000 ED visits. Wow.
Yeah.
That's a little different. That's more than NDRH.
I think, I'm not sure
I
where
don't
the
know where the
data
data
came
came
from.
from.
I thought it came from Voz, but I'm not totally sure. You know,
So that's just
as
one,
board members, we
that's
weren't
just one, but I
involved.
think this is more of an
No, I
online
agree.
conversation.
Yeah, and I will say that I know that
that
there are other ED visit numbers that were not right in that report where I work that were not right. So I would be personally, you know, happy to have an accurate report and the best data we can. I do think the overall conclusions, the top 3 conclusions of the report about the importance of housing, you don't need to have Oliver Wyman to weigh in that, but that just came up in every single meeting he had, was the challenge of housing. I don't think he put a whole lot of effort into that analysis, but it was clearly the front and center of almost every single conversation that he was involved with. I think our commercial prices, the second one being pretty high, and a problem as we have an aging population of hospitals being able to manage more and more Medicare, and also trying to keep stuff in outpatient settings. And I think that's an area where this area has been pretty
All
strong.
I can say is that honestly, and I don't mean to be rude when I say this, but a lot of that information is thank you, Captain Obvious. Okay, we know that. We know we need housing.
Use the microphone,
transportation.
please.
I'm sorry. We know we need housing. We know we need transportation. We know those are major issues in the state of Vermont. We know we have barriers with Act 250. We know all this that he's quoting in a report that we here in the Northeast Kingdom and at North Country Hospital are dealing with every single day, and that we're talking to the Green Mountain Care Board about in our presentation.
Yeah.
So it was nothing new to us.
Yeah.
We know that. Okay. Yes,
I have
ma'am.
a question. To me, it seems like you hire somebody to do a job for you, and they do the job, and it's got a lot of mistakes in it. You don't just say, thank you, see you later. You say, fix it. I don't understand why it has to be any more complicated than going back and saying, fix the report so it's accurate data. To me, it's just very clear. I don't understand why we're having all this discussion about it. Tell them to fix it.
You paid him enough.
I just want to say that it sounds like there's some good things to report, but the mistakes outweigh the good things. I think the damage has already been done up in the public, all right? Somebody on the Green Mountain Board, they need to step and say, this may have been a mistake. right. Which is exactly what it was.
Let's ask for our money back.
Along a different vein, although somebody mentioned this earlier, I think that part of what you have to deal with is not the people that are in this room, but the people in our community that are not here and that don't know what's going on, because that's really damaging. So I would just encourage transparency. If there's, and it has to be in sound bites, it has to be something quick that people will read and can take in and understand. So I would just encourage that as the hospital and as the board works through this, that you put information out frequently that's easy to understand and really clear about what you're doing, so that it helps to temper the anxiety in the community.
One question, how expensive was this report that really didn't amount to a hill of beans, to put it politely?
So, I was gonna say, this predates my time on the board, so.
It's all on our website, but I can give you the number here. It was 1.05 million.
Really? They should have given that to the hospital.
Yeah, right.
It seems to me, it seems that it was pretty much a waste of money, because with the crowd that's here tonight, you're gonna want to redo this study and come up with some better answers than what you come up with.
It should be a freebie.
Yes, sir.
It's already been
Should
paid, the redo.
My name's Peter McAvoy. I'm from Massachusetts. Moved up here in 2022. I worked for Bay State Health, which is a tertiary care facility. 10,000 employees, $1 billion budget. Every year, we were told that there isn't enough money. Every year. My mother was a OBGYN nurse back when that was a midwife. And Farmer Nelson, thank you for talking about the need to have an OB system here. That there's question about the veracity of the report. The choice of making less good outcomes by choosing the period is a veracity issue. It's an ethics issue. The answer, though, sir, from financial services, is not to hire McCain, Booz Allen.
Sure. To hire somebody that knows
McKinsey.
what
It's
they're
not.
doing.
It's not.
Who's the best in this business?
Hold on. I'm
This
not
guy.
arguing with you. What are the data analysis, what does it show is wrong? And what group amongst this team in the Northeast Kingdom is going to state, we don't care what the GMCB report says. Here's the veracity, here's the truth. Let's publish that. Put together a group that will talk about that. Now, one final thing. What I did for Bay State Health was use my legal skills to close multi-million-dollar gifts. And anybody in this room who wants to talk about clever ways to give money to charity, I'm your guy. I did it I've raised over $800 million for the Hartford Foundation for Public Giving, for Bay State Health, for Mount Holyoke College, for Trinity College, for the University of Connecticut at Storrs. I can do this. We can do it together. We need these things to happen. Me and a financial services guy, and some others who are willing to put the resources of the community behind what the community needs. And I remain here for the rest of my life.
Thank you.
Let's make this work.
Right there.
Hi, I'm Kathleen Douglas. We have Rudy's Orchard in Brownington. And you keep saying, I've never had that happen. He just told me louder. We keep saying we have to have our voices heard and we should be contacting people. Is there a possibility of someone compiling a list and putting that out so we aren't hunting all over and going, well, what's the best place to get this to?
It is out.
Okay, thank you.
And I'll continue to send it out.
Yep.
Perfect, thank you.
And I encourage positive messages. not negative threatenings.
My name is Paul Stikkerda. I am originally from the Netherlands, and I don't know if you've heard about the healthcare system in the Netherlands. It's one of the countries on earth where we actually make healthcare about people instead of profits. So that's my perspective on healthcare. 3 years ago, I lived in eastern Pennsylvania, close to Allentown and Bethlehem. We had a choice to make. We had fallen in love with the Northeast Kingdom, and in particular with Newport, the place, but most of all with the people. My father-in-law, who was 90 years old, was living with us at the time, was not doing well. My wife has multiple sclerosis, and I've had a stroke 6 years ago. We had a decision to make. We wanted to be here, but we needed good internet so both my wife and I could do our jobs, and we needed to make sure that there was health care that we could count on. Knowing that North Country Hospital was there for us made the determining decision for us to move here, start businesses here, contribute to the community, to the economy. And boy, did we need it. At the end of his life, my father-in-law had to get a blood transfusion almost every 2 weeks. He got the most excellent and loving care that we could ever imagine. And thanks to your hospital, this last months of his life were amazing. He was a man who was not used to looking at the bright side of life. But coming to your facility, feeling the care that he got from the nurses, he felt seen. He was a person, not a number. He was looking forward to his transmission because he got the great food and the great care from your people. We can talk about data, but data don't bleed. People do bleed. My wife's life was saved. She got COVID. She was in isolation for a week. You guys saved her life. And I thank you for that for the rest of my life. I have a stroke, and as you know, once you've had one, the chance of getting another stroke is not as good, but you'll get another stroke. You're more likely to get another stroke. I don't know what I would do if I knew that the hospital was not there available for me to take good care of you. And I worry, and I'm afraid, and I'm so glad that we're here, and we cannot let this hospital go down the drain. Because once you lose it, you will never get it back. Thank you for all the care.
And my wife passed away 3.5 years ago. And if it wasn't for this hospital, she would have died 20 years ago. Because I brought her to the emergency room. I didn't know what's wrong. Her potassium level was so high. And once I got her in there, she actually died. And then they brought her. But that hospital was not there. She's been passed away 20 years ago. But there's one question I'd like to ask the member of the board. With all this information that you have, would you agree with it right now, yes or no?
I mean, it's 122 pages.
Well,
So
you have read it right now.
I have. And I would say there's a lot in there I agree with, and there's things I don't. And that's when you got a 142-page report, that's what you're going to see. But I also, my perspective, speaking for me, not the board, and I should have said that at the beginning, because it's a caveat I'm supposed to say, only the chair can speak for the board, but my perspective is I am very, very, very passionate about community health care, rural health care, and keeping care where people can get care. And I try to bring that dedication and that passion to the care board every day and bring stories of my patients who struggle with those issues every day and the importance of that. Because like you have in a small hospital like this, big enough, but small, those personal connections, it's just a different thing. Not that the big hospitals can't provide great personalized care with close relationships, but I've worked in a bunch of different size hospitals. I worked at Franklin and Bay State, which are gigantic and small, and I work at CVMC now, which is, you know, not, is medium, but it's anyways. This is important to me to be here. It's important to me to hear this, but I want you to know that it's important to me to bring this voice and to bring those voices back to the work that we do every day.
I appreciate that. All I want is common sense. That's it. Common sense.
Yes, ma'am.
I just have one question. So if the recommendations are incorrect, how quickly will it take to get them changed so that you in North Country can hire people? And that they be made public, the changes be made public so that you can turn around and hire people and they know that the hospital is going to be here.
So that's a really difficult question because we've reached out to Dr. Hamrick. And in most cases, it's radio silence back. So we don't necessarily feel we have a voice to change the numbers. What we do feel we have a voice to do is make sure we get it out there to the community that these recommendations are no more than that, and we're not going anywhere. We're not changing. We're going to continue to do OB. We're going to continue to have an ortho program. We're going to continue to do all these things we're doing today because we are here for the community. We do great health care, and we're financially stable. So that's the message we're trying to get out there.
But you're having more difficulty hiring because of those recommendations. That's what I'm saying.
Once the horse is out of the barn, it's tough to, even if they change the numbers, there's still going to be a perception. So we need to just prove it wrong and do the best we can with what we got. It's already very difficult, as you can imagine, to recruit in the Northeast Kingdom. Any position that's in this room, anybody in administration in this room realizes recruiting in the Northeast Kingdom is not easy. It takes the right type of position. We've got amazing doctors. Harvard, Yale. I mean, Greg Walker grew up in this community. Okay, we've got amazing physicians that it takes a certain person to want to be here. And regardless of that report, we will continue to get those amazing people. We just signed a third primary care doc this year after the report went out. So it's not all doom and gloom. Yes, ma'am.
I'm a local person. I went to high school at North Country and graduated there, but for years I lived in Chicago and I worked in medical education. And I worked at some of the biggest hospitals helping doctors educate medical students and residents. And I can say that coming home to this hospital, I was overjoyed. I personally have had health care. I had abdominal surgery at the University of Illinois Hospital in Chicago. Some of the best care I have ever gotten is at this hospital. Take it from me. A lot of these hospitals are big hospitals that do train. They are affiliated with universities. They have all the high tech. They have all the latest info. This is still the best hospital I've had the pleasure of being taken care of by.
Yeah, I'd just like to address the board members that are here. Thanks for coming. Thanks for braving it. But I would ask from a community standpoint that you bring back, as a director and as a board member, that you bring back the true message that's here. If you care about people and you care about, as you said, you care about patients and care and all that, and the Green Mountain Care Board actually cares or wants to be the Green Mountain Doesn't Care Board. So, I say that only because I'm hopeful that that board structure is not such that you feel like you can't bring something back and you can't speak up and only the chair speaks. And if that's the structure of the board, then it's an issue. But I would ask from the community standpoint to bring that back, because if it was not easy, but if it was as accessible as Dr. Walker and Dr. Stewart to be able to get information on data that potentially could have been assembled in a document and maybe plagiarized to some point, taking 1990 data and taking
somebody's OBGYN study and piecing that into a study, I'd do that for $1,050,000 to piece something together. And I know you would too. But at the end of the day, if it's that easy for these guys to find that data, then I would recommend that the board goes back and does their own research on the data that's conducted in that study and do that research. If it's just as easy for you to find it, then that board really has to take a look at what did we really get for this. There may be no change that happens. There may be no recommendation that happens with that study. He's already been paid, I understand. So at the end of the day, if you can bring that back of what you've seen here tonight, there's a community that cares a lot about. Man, every one of these people in here has a story of somebody that's in there. Greg put my wife to sleep, saved her life, like all sorts of things have happened with these docs and amazing people in this facility. And it's not just North Country, it's these other hospitals that are probably dealing with the ramifications of what this study that was put out there by your board, appropriated by the legislature, I'm not sure. But if we follow the money on this thing, and some of us will, we want to make sure that, we the people have a voice, because we the people direct all those funds that go for some of these things and support these boards and do that. So at the end of the day, it was easy for these guys to put that together, and for Dr. Stewart to get a response like that, I'm sure you guys can get a response as well. So I'd ask in behalf of the community that you would go back and you would actually have that conversation at your very next board meeting. Thank you.
Thank you. So we had quite a list of people that had signed up to speak, but I will say that it's after 7, and I think that our message is out there. So I would suggest that if there's anyone else that would like to speak up, now's the time. Right.
Thank you. I'd just like to offer my services at $10,000 a page. I'd be happy to rewrite something. I'd love to tell you, I sell cars for a living. I'd love to tell you guys cars that you like spending money, so I'd like to see a better report for that kind of stuff.
Linda.
Thank you. You're amazing. I want to ask everybody to please reach out to former Mayor Beth Torrance. We are going to be having on October 18th a press conference. Tom and I will be there along with council members addressing many of these issues. I've already, Beth and Tom have put together a bus, so if you need transportation, please reach out to Beth. We have lots of letters of support that we are coordinating as well. And I did just confirmation to you, Tom, hear back from the governor's office, and we will get that.
Thank you, Mayor Sullivan, very much. Ma'am.
Yes, my name is Holly White, and this is more a legal question. The Attorney General's office has a civil division. I was wondering if it would be worthwhile for you to contact them to see if they would review the original contract, and given all of the misinformation that's in the report, it may not have met the standards that the contract requires. Is that worth looking into?
I'm an accountant. I'm not a lawyer. So that's a question for, unfortunately, I can't answer that, but I will say, legal consultation is not off the table for anything. So,
okay.
Thank you. Anyone else before we break up the party? Larry.
Thank you. Thanks everybody for showing up. This is really showing good community support. I guess I'll have to raise my volume. For those who don't know me, my name is Larry Labert. I'm a select board member from the town of Morgan. I also serve in the House as a representative from the state for this area. And I'd like to inform our guests tonight what rural really means. My constituents that are furthest away are 61 miles from this hospital. That's beyond Canaan. That's Beecher Falls. Next turn is Canada. Right-hand turn takes you to New Hampshire. Can't get there from here. There is no interstate. That's just one comment. Out of the 12 towns that I represent in 3 Gores, I would challenge our guest speaker, Keith, I believe his first name was. How many towns does it take him to get to 4,609 residents? Takes all 12 of them. I read the report. For Dr. Berman, it's page 75 to 78. I've attended multiple meetings regarding the costs of healthcare, not just hospitals. And in reading the proposed recommendations put forth by Oliver Wyman, I was simply aghast at how he could make those recommendations. The lack of accuracy, the usage of bad data that doesn't represent the last year, data coming from COVID era, a pandemic that this hospital saved lives in. The recruitment damage, the economic deterioration of this community as a result of losing over 600 employees is unconscionable. Business investment in the Northeast Kingdom will be stifled. Bringing in young families when there is no OB department, and at best, a freestanding one with midwives. Who are they going to call at 2 o'clock in the morning? I rest my case. If you have no OB department, how many pediatricians are you going to have around? I see an exodus coming if this goes through. This is impossible for recruitment for teachers, not just healthcare workers. I spent 47 years in that hospital. I started off as the director of pharmacy. Yes, I know you recruit. Yes, I know the hard things. But there's a reason retail stores have closed. And I'm talking about pharmacies. The margins have disappeared. Everybody blames it on Big Pharma. Well, let me tell you, until you change tort reform.
Amen.
Thank you. And until you look at the cost drivers. Who is the biggest purchaser of health care in the state of Vermont? The state. 70% of our clients, our patients, our residents are below the poverty level. Now you want to talk about the quality of health care, you won't find quality listed in 75 to 78. I've experienced health care. I've gone from a provider to being a consumer. And you want to talk about quality of care of the elderly? Last Saturday I celebrated my father's 103rd birthday. I think that spells volumes for the quality of care we have here. It's not just healthcare workers, teachers, contractors. How are you going to build new houses if you can't get contractors to move in? It might be a little bit difficult. Hang on here. The data is flawed, it's outdated. Many of the recommendations have already been accomplished. That's why you have a $200+ million in the kitty. The actual deficit was not North Country Hospital's fault. They didn't precipitate COVID. They didn't precipitate the inflation. I should say, raise the inflation. And the failed capture of revenue from a failed IT system. That's not a good thing, and that was 10.3 million. What is missing from the report? I'll tell you what's missing. The cost conversion dollars that have not been looked at if you're going to deal with a freestanding birthing center, a freestanding surgery center, a freestanding radiology center. Who's going to build those buildings? Us taxpayers? At the closure of that services at North Country Hospital? A 16-hour ER? Who gets sick by appointment or has an accident by appointment? I don't think that works. Who's going to pay for the transportation to a tertiary hospital? Helicopters flying. I'm a pilot. 26% of the time, it's servicing another hospital, another ER, or the weather has grounded them. Funny, we get snow up here. So the outflow of this falls on the patient's families or caregiver to do the transporting. How much money is that going to cost? None of these things have been explained. Well, I have an old saying my father still used. When dealt with lemons, make lemonade. And it's time for that to go back to the care board. Thank you.
Chet Greenwood. I just got a short comment. None of these doctors perform any procedures without knowing all the facts, blood pressure, whatever. So why does the Green Mountain Care Board, why don't they operate under the same standards? They're making decisions under the medical society with flawed information. If doctors did that, everybody would be dead. So I think they'll let the lady said over here, it's time to maybe get her money back or her money's worth.
One more.
I got one message to the Green Mountain Care doctors there. You're probably going to get the same type of reception at the other three hospitals. You're allowed to make a motion on the board, right? When you guys have a meeting, why don't you make a motion to abolish this damn thing and get it over with?
Ma'am.
Second.
Hi, good evening. Hello, my name is Dr. Monique Thompson, and I actually live in Newport. I live right on 2nd Street. I'm a naturopathic physician. I'm a primary care physician. Vermont is one of the states where people probably know what that is, hopefully. But we are primary care physicians. I also work in healthcare administration for the Blueprint for Health, and I'm also a critical care paramedic. So I see healthcare in Vermont from a lot of different aspects, and I really feel what you all are feeling as a community, because I live in it, I work in it as well, and I am that person who is helping to cover these thousands of square miles. And I see the great lack of access in these rural areas. Now, I want to put something forth, and I've been trying to reach your office, Mr. Frank, because we talk a lot about Vermonters not having access to health care. And like I said, there are very tangible gaps in healthcare in this area. I have opportunities, professional opportunities, where I could go to Burlington and I could work as a naturopathic physician. You know, we are primary care docs. But up here, it's a challenge. And so I want to put it as an opening, because there are 426 licensed naturopathic physicians in the state of Vermont. And we cannot be hired by hospitals. And I know this is a legislative thing, and there's a lot of work around it. But seeing that we are having the conversations about being active, about having people, professionals perform at the top of their license, I say look into having naturopathic physicians, because there are a lot of skill sets that could be closing some of these healthcare gaps. So that's one suggestion. And there has been a lot of really good sort of action steps. The community is resolute about resolving the issue around these recommendations. And I would like for you, as a leader and a voice, to give us one tangible thing that we could do, all of us, that we could do tonight to help push this agenda. There were, we could call this person, we could write to the governor, tell us what we could do and who we should be following up with so everyone could see that we are unified, we're moving forward and really addressing this, and we want concrete steps, not just talk and waiting weeks and weeks. We want to strike now and address it now. So give us one thing and one person that we could follow up with, please.
You're actually doing it tonight. You're doing it tonight. You've got Green Mountain Care Board folks here. I believe AHS is here somewhere, I'm not sure. On top of that, letters are being written to both of those organizations, to the governor, contacting our federal agencies, writing to the newspapers. Anything, any voice that we can get out there is being heard. And so when you say one tangible place, we have multiple options. Where's Wendy? Wendy, on our website, I believe we have a list of where we would direct folks to write those letters to. So we can connect you with that for sure. And as far as getting in to see me, where's Jen? You talk to Jen DeRoche and she'll get you in to see me anytime.
Sir, you said Gwendolyn?
Jen, right over there. Okay, one more and it's probably time to break it up.
Just really quickly, I know some years back, Copley Hospital in Morrisville was designated as a critical care facility because it's a distance to a bigger hospital. Is North Country a critical access?
So actually, Copley received a waiver. Senator Sanders, who does a lot of great things for healthcare, was able to get waivers from other hospitals to not have to live by the distance rule. The only hospital that qualifies under the distance rule in total is North Country, because we are the farthest away from any hospital and the farthest away from maternity.
So does that still hold any weight?
I hope so. I certainly say it enough. I know these guys have heard me say it a million times.
Okay, good.
And that's exactly why this hospital needs to stay as it is.
Yeah.
Thank you. All right. One more. I think we should break it up. Oh, Mr. Knoll.
I just want to thank you on behalf of the community for putting this all on North Country Hospital and your staff, doctors, and the Green Mountain Care Board. I have to say that the Green Mountain Care Board is given a different name these days. Adult Care Board comes to mind. So we hope to go away, and we don't want to use that name, but that's come up a lot. We want to demonstrate by your actions following this meeting that you really do care. And that's important to this community. Everything's been said tonight. So many things have been said here that go against what you put out in this recommendations report. It's overwhelming. So I hope you go back with that message. And this community really cares. And we deserve better. Thank you.
Thank you, Frank. I really appreciate you coming down tonight. Thank you.
All right.